So, Dr. Scholes, today we're talking about radiation side effects. Now, we've talked about the concept of radiation burns or proctitis and the fact that there's, gels like Spacer and Barrigel to solve those nowadays. So maybe that issue is a little more solved. But there's other issues such as the urethra going through the prostate, and oftentimes men can see blood in their urine. There's other long-term side effects. So can you explain the effect of radiation on the prostate, specifically when it comes to the urethra, and what patients can expect?
Yeah, the radiation therapists have been able to shoot around the rectum now with the new gel and spacers, and we've talked in the past about the fact that men can develop erectile dysfunction from radiation, but we haven't talked too much about the potential damage to the urinary passage that goes right through the middle of the prostate and invariably incurs some radiation damage as a result. The most common manifestation that shows up, and it's pretty common, honestly, where men 6 months, 1, 2, 3, 4 years after the radiation will say, I'll get a phone call. There's blood in my urine, and this really does scare people to see this out of the blue, and they don't connect it with the fact that they had radiation 3 or 4 years past. People don't realize that there is sort of a permanent weakening of the urethral wall. We counsel patients to kind of wait it out. If they're taking aspirin, stop taking the aspirin. We do need to check and make sure it could be something unrelated to the radiation. There could be a urinary tract infection. Kidney stones can cause blood in the urine. We always have to keep in the back of our mind that if someone had a bladder cancer, that could cause blood in the urine. But we see blood in the urine after radiation fairly frequently, and I think men that are thinking of doing radiation as opposed to surgery, and I generally steer people toward radiation and away from surgery, that this is a problem that can surface after 2, 3, 4, 5, even 10 years after radiation. One of the main implications I like to bring to people's attention is that the usual approach to your average urologist who sees a patient with blood in their urine is to do something called a cystoscopy. A cystoscopy means putting a fiber optic vision device up the penis to look in the bladder and make sure that there's no bladder cancer. And that's understandable. If we just assume that radiation damage is causing all blood in the urine, we're going to miss some bladder cancers along the way, and at a time when they could have been cured if they were diagnosed in a timely fashion. Doing cystoscopies in people that have had previous radiation to their urethra is a little more dangerous because the tissue is weaker and more friable. Fortunately, there is a relatively new urine test out called Cxbladder that can very accurately diagnose bladder cancer at an early and curable stage. When your urologist wants to do a cystoscopy, talk to them about maybe doing a urine test called a Cxbladder, along with the other urine tests, because they'll probably do a urine analysis to make sure there's no infection. And if someone has a history of kidney stones, we would look for that as well. The urethra will always be a little bit weak after radiation for the rest of that patient's life. And periodic blood in the urine is not an uncommon thing that we see in men that have had previous radiation.
Before I get to my next question, I just wanted to remind you that we're a nonprofit and all of the videos that are for free on YouTube are because people like you have donated. So if you would like to join our cause, you can do so at pcri.org/donate. Now back to this video on radiation side effects. So when it comes to bladder cancer, what is the likelihood of a patient getting it? In prostate cancer, we have 1 in 9 men get prostate cancer. What is it in bladder cancer?
It's not anywhere near as common as prostate cancer is, but prostate cancer occurs in aging men, and all cancers tend to occur as we get older. And it's such a simple thing to screen for. And part of the annual physical exam is to do a urine analysis. And the reason primarily to do a urine analysis is to look for any stray red blood cells in the urine. And if those are discovered, to look into it further and make sure that it's not an early stage bladder cancer that's causing some blood in the urine. Early stage bladder cancers are relatively easy to cure with these scopes that I mentioned, cystoscopies. Doctors can go in and they can just peel off or burn off the small bladder cancers on the inner lining of the bladder. And by catching it at an early stage, makes life a lot simpler. So this is the occurrence of aging in general, and there is a good strategy for handling it, but now that we know that blood from the urine could just be from the radiation, we can adopt a slower view and perhaps use Cxbladder testing rather than these scopes that I mentioned.
So when we talk about radiation, we have beam radiation and then we have seed implants. Is the blood in the urine something that can occur also with seed implants, or is it only with beam radiation?
It's with all types of radiation because the radiation doctors do try and reduce the amount of radiation to the urethra. They can put a catheter in and they can see where the urethra is, and they can adjust their fields to some degree. But they don't want to adjust them too much because prostate cancer can be nestled up next to the urethra, and they want to make sure they cure it. So they're very clear in terms of what degree of radiation the urethra can tolerate, but they push it right up to that, and your body will remember that radiation for the rest of your life, and the urethra will always be a little bit weak in people that have had previous radiation.
So what is the timeline that a patient can expect? Are we maybe going to see blood in the urine 6 months out, a year out?
Someone could have no problems whatsoever for 5 years, and all of a sudden there's blood in the urine. The body does remember the radiation forever.
Is there any way to stop the blood in the urine once it's discovered?
If people have serious ongoing bleeding problems, which can certainly be an issue in some individuals, the usual first step is to get off blood thinners if you can. The second step is to take some vitamin E and a medicine called pentoxifylline, which aids healing. The third level is to use something called hyperbaric oxygen. They have these pressurized chambers. I think they were originally developed for people who have diving accidents or they're underwater for too long. But they can put high percentage oxygen in the atmosphere, and this promotes healing of damaged tissue. And it's a little inconvenient because you have to stay in this chamber for like an hour a day, off and on for a month. But it can be very effective.
What do you do in situations where somebody's on a blood thinner, maybe for a cardiovascular issue, and then they need to get off the blood thinners because of the fact that they're seeing blood in their urine?
Well, it can be very challenging, and there needs to be a dialogue between the treating doctor, the urologist or the oncologist, and the cardiologist or whoever ordered the blood thinner to find out how important it is. Can they take a short holiday? Can they go off the medicine altogether? And there are certain situations where you don't have the luxury of stopping the blood thinner, so you have to go to these other measures that we've mentioned, hyperbaric oxygen or pentoxifylline.
So you mentioned Cxbladder. Is this covered by Medicare? Is it easy and accessible to patients across the country?
Yes, it's a simple urine test. It is covered by Medicare, and the good news is it's very accurate, and in many cases, men who do have some blood in their urine can avoid getting a cystoscopy, because the other causes of bleeding are not going to really respond to having someone stick a scope in the penis. Kidney stones, you don't have to stick a scope in the penis. Urinary tract infections, these are the other reasons we see blood, or radiation damage. That could actually be deleterious if you damage the urethral lining when you put a scope through there. So the Cxbladder is a nice way to help men who don't have bladder cancer to find out that they don't have bladder cancer with that test and avoid the cystoscopy. If the Cxbladder were to show that bladder cancer is present, then a gentle cystoscopy is going to be necessary to get further details and possibly to treat the bladder cancer.
Recently, I've heard of a new assay that is able to predict radiation toxicity or radiation side effects. Does that apply to situations where you would see blood in the urine?
Yeah, you're talking about Prostox, which is still in the investigational stages, but available through a company called Miradex. It can be looked up online. They do a mouth swab, and they are determining if you have a predisposition towards radiation damage if you undergo radiation. And I think this is a very useful test for people before they go into have any kind of radiation to determine which type of radiation would be best, or maybe they should avoid radiation altogether, because it's the long-term side effects of radiation damage to the urethra, which is what this genetic test, it's an assay to predict the likelihood of developing these problems. So they can be avoided altogether if people can discover that their own genetics are not going to mix very well with radiation treatment.
So in what percentage of patients are you seeing this occur?
I would say it's a very common issue. Up to 1 in 4 patients that has radiation will at some point call their doctor and say, I've got some blood in my urine, what's going on? The incidence that I'm describing can probably be reduced if men were screened first with Prostox to find out who's more predisposed to this. And we can certainly tolerate a little bit of blood in the urine periodically if we can avoid a lot of the other scary side effects, for example, that are associated with surgery, like incontinence and ejaculating urine. So we'll put up with a little bit of a blood in the urine problem, considering that the other alternatives are not attractive. But if we could find out who those people are that have really troublesome large amounts of bleeding, or, as you pointed out earlier, that if they have to be on anticoagulation the rest of their lives, it's a much more high-stakes decision to go through radiation and possibly end up with a problem like this, when you could find out in advance that you are predisposed to this and perhaps should avoid radiation.
So with the 1 in 4 patients experiencing blood in their urine from the radiation, how often is it, kind of a mild symptom, or how often is it really a severe situation?
I'd say 90% of the time it's relatively mild. I call it mild. I'm not the one that's seeing blood in my urine. The good news is that it usually clears up on its own. It usually doesn't represent bladder cancer or some dire problem. It's just a sign that you have had previous radiation. But it's very scary when you see it. I would say that 90% of the time it doesn't turn into a problem. It may recur occasionally, probably with less and less frequency, and go away, and then it may show up again a few years later briefly. It's more of an emotional and somewhat scary thing when you see blood in your urine, but it doesn't usually turn into a problem. There is a minority of people where they have non-healing, discomfort, bleeding, radiation damage, and this is where that test, the Prostox test, is useful for ferreting out that smaller segment of the population that just doesn't heal and has ongoing difficulty.
In modern technology, there's the concept of spot radiation, and is that something where we would see blood in the urine with things like spot radiation?
Well, spot radiation to the prostate typically involves encompassing the whole prostate. And by doing that, they will also treat the urethra, which goes down through the middle of the prostate. There are some mavens on the cutting edge of modern therapy that are starting to do focal radiation into a section of the gland, which can miss the urethra altogether, and that's certainly advantageous. This is not commonly or widely available, but momentum is picking up toward trying to do focal radiation rather than whole prostate radiation to avoid this problem altogether.
So today we talked about a radiation side effect that can occur in 1 in 4 men, which is blood in the urine. And if you go online, maybe you see it as hematuria. But the reason I'm bringing this up is we want to make you aware of the side effects that can happen with radiation therapy. And if you do see blood in your urine, call your medical team right away and let them know. And if they don't know about, the different treatments that Dr. Scholl's mentioned, bring it up. He's a medical oncologist with 30 years of experience in prostate cancer and in BPH and prostatitis and all of these issues. Maybe your medical team, if you're seeing a general oncologist, maybe they don't mention the hyperbaric chamber or other things that can help promote healing. So you bring it up and advocate for yourself. We want to make sure that you're advocating for yourself in situations of deciding upon treatment, but also in situations of mitigating side effects. The side effects of these treatments can be quite extensive, and sometimes they can be quite minor, but either way, we want to make sure that you are taking care of yourself from a holistic perspective, and making sure that you're taking care of the individual side effects and your individual needs. If you need help with your personal case, you can visit pcri.org/helpline. Our prostate cancer patients have been through a lot of these experiences, and if they haven't, they've also been trained by our medical oncology team, so they can help you gain information so that you can have better outcomes in your conversations with your medical team. And also, if you would like to join our cause of getting these videos out for free to the world, you can do so at pcri.org/donate. We really appreciate the help. But most of all, please remember, you're not alone. We care about you. We want you to take care of yourself. You're an incredible human, and we look forward to being able to help you further through this channel. Please subscribe to our YouTube channel and give us a thumbs up if you found this video helpful, and leave your questions or comments in the comment section below. This helps us develop content further. I hope you have a great week, and thank you so much.